genioplasty and jaw sculpting. In his own words, he's a young fellow. He doesn't want any occlusal correction to change his bite. We see slight protrusion over here. It's only the chin that he's concerned about. He wants a chin which suits his face, a chin which is lengthened vertically as well as horizontally. What changes are you looking for particularly, if you would like to share with our audiences? Surgery, what changes? Tamil, okay.
English like it. Tamil கேளுங்க.
Tamil. Genioplasty, chin surgery.
எதுக்காக பண்றீங்க?
எனக்கு பிடிச்சிருக்குனா.
Okay. He likes it.
You like a chin which is lengthened, which is more ahead and which is increased vertically as well as horizontally. So you want a long chin?
உங்களுக்கு கொஞ்சம் லாங்கா சின் இருக்கிறது பிடிக்குமா உங்களுக்கு?
லாங் சின் எனக்கு அதனால இங்க கட் பண்ணி கொண்டு போறேன்.
சரி. நீங்க எப்படி
ரெண்டு குழி விடுவாங்க.
ஓகே. நீங்க எப்படி இங்க வந்தீங்க?
நானா தான்.
ஓகே.
ஃபர்ஸ்ட் ஒரு தான் வந்தேன்.
And how did you come to know that such a procedure can be done here?
எப்படி உங்களுக்கு தெரிய வந்துச்சு அந்த மாதிரி ஒரு ப்ரொசீஜர் இருக்குன்னு சொல்லிட்டு?
நானா தான் ஃபர்ஸ்ட் பிரேசஸ் கட் பண்ணணும்னு நினைச்சேன். அப்புறம் நான் யூடியூப்ல சர்ச் பண்ணி பார்க்கும்போது
Okay.
He came to know through YouTube, right? Yeah. So the awareness is spreading, as he said that he was told for orthodontic treatment, and that is primarily because of the protrusion of the upper and the lower teeth. But his desire is for the chin augmentation, both vertically as well as horizontally. So it will be an extended genioplasty and jaw sculpting by Dr. Richardson, which is about to begin in a few minutes. Thank you.
So this is just a genioplasty with jaw sculpting, but it's a major movement that we've done. வலி இருக்காடா? எடுக்குள்ள லைட்டாக வலி இருக்குல்ல? நான் ஒரு நிமிஷம்
முடி
தெரியும்டா ஒரு So he says that I'm pulling out some hair. Well, konchonda. So this is soaking now. So I mean, I keep saying this when I do for every patient. Anyway, to get back to what we've done. So we've done what is called as a safe, predictable, for life chin augmentation. I like to call it so because we're moving the bony part of the chin forwards. Along with comes the muscles that actually move the tongue a bit, the muscles around the lips. So the patient has mudijira. I'm going to put a little bit more for him. It's just okay. கொஞ்சம் கொடுத்துங்க so that maybe I can do this and then gate control theory. Okay. Okay. All right. ரெண்டாவது போட்டு கொடுக்க பரவாயில்ல தலை சிக்குதா? So right, I'm going to show you with a side view now. This is just எவ்வளவு நாள் ஆச்சு அவனுக்கு பண்ணி? 4 நாள் தான், 5 days. So just today and so you can see this. That's it, Babu. And you can see the improvement. This is 5 days. Look at this jawline now. Look at that. So we've got a nice full jawline for him. I'm going to move on to the other side. Hey, you want to talk about Parni? Parni, side lo chuparu. A side lo chuchu. Terida. Inda mari birne. Say inda pakku Parni. So we're going to show you the this view. Also, there's a lot of swelling now. You see, all of this is swelling. This is just day 5, so a little over 4 days. This will all go in, and then you can see the chin where it was to where it is now. Yeah, so you can see the similar thing on this side. Straight jawline, nice projection of the chin, good proportional vertical height, nice horizontal projection. Eventually it will growing. This is going to happen. This is because of the edema. Once this happens, you get a nice mental projection, and that's going to match with his whole face. And so you can see here also now. Pardon? You will test it again. This is actually on the tree. So yeah. So once it goes inside, then you can see a great improvement. So thank you. So what's essential here in genioplasty with jaw sculpting is a cut is made in the chin behind. So in this case we make a cut right from here. So then the cut is made inside, and this part of the chin actually almost extending to the body of the mandible. This is the chin, the front part of the mandible. This is the body, this is the angle. Now, even though genioplasty usually doesn't extend to the body, and extended genioplasty, then we have to do large movements and even take it up the angle sometimes. So in this case, it's not all the way up the angle, it's in between, but well posterior to the nerve. The nerve is here. The mental nerve comes out from there, roughly, I'm saying. So the cut goes well beneath the nerve. So that's why you can see the plaster. The plaster where I put is an indication to know where the cut is. So if it's like this, it's roughly going to be here, the cut, and likewise here. So that's an extended cut. We've given him an extended cut because we needed more movement. We want more stability for the segment that's moved forward, and we've used 2 plates and 4 screws. That doubt இருக்கா? வலி இருக்கா இப்போ?
இந்த போன் வலியே தெரியுமா? வீக்கம் பண்ணுங்க.
கொஞ்சம் குறையும் வீக்கம், நல்லா வீக்கம் குறையும். போன் முன்னாடி வலி தான் தெரியும். அது சர்ஜரி பண்ணிருப்போம். முள்ள போகும். வலி இருக்கா உனக்கு அதுல? இல்ல இல்ல. அப்பா அம்மா என்ன சொன்னாங்க? திருப்பி வரணும் 1 மாசம் கழிச்சு செக்கப்புக்கு. அப்பாயின்மெண்ட் எடுத்து தருவோம். டாக்டர் just give appointment. So come back after 1 month and then பார்த்துக்கலாம். Okay?